Hello, my name is Eleanor Buchan, and I am a student in the Honors College here at Lone Star Kingwood. And today I'm going to be presenting on Left to Labor in the Baby Factory, Doulas as a solution to indigent patient care in public hospitals during the 1970s. Now, if you look at this picture, this is from the Jefferson Davis Hospital, also colloquially known as the Baby Factory. And you can see there are all of these cardboard boxes. There were so many babies being born in this hospital every day that they had to tape cardboard boxes together to have enough room and a space to store the babies, so to speak, so they wouldn't be jostled and knocked onto the floor. And the level of care at Jefferson Davis was really not the best. It was serving people who were not really able to pay for their own medical bills and thus had to be served by public funds. And so they were coming to this hospital. And as you can see, the level of care with this quote, "My wife had a baby at 3:04. It is now 8 o'clock and she still has not seen the doctor. When they finally took my wife into the delivery room, the baby's head was showing." And this was pretty commonplace. Now, I found this very interesting, of course, and so it led me to my research question of how did indigent patient care in Houston public hospitals during the 1970s, along with societal and institutional pressures, influence the framing and definition of doulas? Now, to answer this question, I used Charles Rosenberg's framework of framing disease, his conceptual model, and it's pretty well summed up in this quote. But the part that I'm using more specifically is Rosenberg explains that once a disease is agreed upon by society and given a name, then it can be socially framed. And I'm going to argue that you can do the same with professions. And to make it a little bit of an easier transition, it will be a profession within the medical field. And I want to look at how societal influences and institutional pressures have shaped the role of doulas as they've evolved after being named as an official term. So we're going to go through a timeline of the evolution of doulas. And we're going to start way pre-1950s. This is a long, long time ago, ancient times. These are Roman carvings. And doulas, although we'd never called them that back then, there was still this informal role of a woman who would support another woman through childbirth. And they would also be called wise women. This was a thing in Africa as well. Wise women was typically the term for that. And birth was a natural event. It was a life event, a family event. You were surrounded by your peers, your friends. And then things started to shift when we get into closer to the 1950s in the mid-18th and 19th centuries. And over here, we start to see the medicalization of birth with the use of tools such as forceps, as you can see pictured there, along with epidurals are used. And this medicine that is popularized by feminist movements who women want to reclaim their experience of birth, and they think that the best, or they decided the best way to do this at the time is pain-free. Birth is, of course, very, very painful. And so there's this medication developed called, or this process called twilight sleep, and it's a combination of morphine and scopolamine, and it completely knocks you out. You're completely unconscious, and when you wake up, you remember nothing. So you give birth, and you wake up, and oh, look, the baby's there, and I don't remember anything from the past few hours. That's essentially the experience. And this was popularized by the feminist movement, but views on this process did change later. And by the 1920s, we're seeing birth being hospitalized in addition to medicalized. By 1950, once we get to 1950, and by 1960, about 88 to 97% of all births are in the hospital. And this is because of this heavy use of forceps, epidurals, anesthesia, and birth is framed as no longer being a natural event, but an epidemiological event and a disease of sorts that needs medical intervention. And this sparks, as we get into the 1960s, well, it doesn't necessarily spark, but we're seeing around the 1960s a lot of cultural shifts and changes, especially with social movements. And we see the countercultural movement where there's this going against the norm. You see hippies as they're termed. There's a rejection of social hierarchies and norms, conformity and middle class values. And it's also marked by casual sex, which we also see in the sexual revolution, which also is the advent of, now we have the pill for birth control, and abortion starts becoming available to people. We also see the second wave feminist movement, which is focused on women's equality, discrimination, civil rights, and legislation of birth control specifically. And the sexual revolution, you see the norms of monogamy are challenged and you see a great increase in premarital sex. But because we're having these developments in birth control care, there isn't such a big spike in births. There is a big spike in pregnancies, though, which we'll see later. And all of these cultural factors really set the stage for the emergence of this patient and mother-centered approach that starts to become popularized a bit later, trying to focus less on the medical aspects, but on the mother's emotional needs and supporting her through birth. And we start to see some research around this topic happening in 1969, when Dana Raphael coins the term doula as we use it today. So doula comes from the Greek word, as you can see there, and it means, directly translated, it means slave or slavish work, and the feminine form means bondswoman. And so this was coined to represent a behavior specifically, or a type of action, being mothering the mother. And during ancient times, the word doula officially was used, there's another mic. The word doula was also used to describe the women who would unofficially care for mothers who are giving birth and cared for them during and post-labor, and was typically not compensated in any way. And so this is kind of where my research really takes off. We see the word defined, so society has agreed on a definition for this word, and now it can really be shaped by society into something new. Now, in the 1970s, we see some very, very big shifts with the natural birth movement. All of those societal movements that we talked about before, countercultural, sexual revolution, and the feminist, second wave feminist movement, all of those are coming together and still happening up until the 1980s. And by the 1970s, this natural birth movement happens where women are like, we are fed up with the medicalization of birth, at least some. And the twilight sleep, many women felt that by going through twilight sleep and waking up and not having experienced birth, which is a very, very life-changing event for many women, that was something that they were losing. And so they really wanted to reclaim that. And in this 1970s, we also see the teenage pregnancy epidemic really takes off. And I want to point out that, as you can see, 1970s, this is where we see a big increase in the rate. And over here, we see a little bit of a spike in the actual births in the 1970s. But soon after, that's about when abortion is legalized and the pill as well becomes more available. So you do see a bit of a decrease. So it gets a bit more normalized. But especially in indigent communities where they may not have access to the pill or abortions that are safe and, well, that they're able to pay for, you see a big problem of lots and lots of teenage births. And this is something that is particularly happening at pretty impressive rates at the Jefferson Davis Hospital that we mentioned earlier. And in this hospital, around this time, like the mid-1970s, late 1970s, almost 14,000 babies are born in that hospital, which is more than, at the time, than any other US hospital except for one that's in Los Angeles. And they were born mostly to the poor and displaced. So immigrants who are coming across the border, women who were 12, they had two 12-year-old births in that hospital, lots of 13-year-olds as well. So people who are underage, and some didn't even know what giving birth was or that they were pregnant until they realized, oh, I have to deliver this baby. Kind of crazy stuff. And then we get into the 1980s, where these two men, Marshall Kloss and John Kennel, conduct a research project in Guatemala. And they're looking at mother-infant bonding, which is not quite the same thing. And they have this female observer come in and just observe the patients. And they find that their laboring times for how long it takes for them to go through labor cuts over in half. And that's a very, very significant finding. So they're like, this is very interesting. We should maybe look into this more. And so this is where we start seeing these two men really push a lot of this reframing of doulas. And we see in the 1980s, they're going to conduct a study very soon in the Jefferson Davis Hospital. And this is another picture from that hospital. This is one of the waiting rooms. There's like standing room only, essentially. It would become very crowded. And so the reason that the Jefferson Davis Hospital is so important to the definition of doulas and the reframing that happened is a really pivotal study that I will talk about in a bit took place there. But it really set the stage because this hospital was extremely overcrowded, underfunded, it was understaffed, and pretty unsanitary. Most people were in agreement that it was to put it blatantly, a pretty nasty place. And there are nursing shortages going around all over the country, but even in times where there wasn't nursing shortages, there were definitely at the Jefferson Davis Hospital because no one wanted to work there. There are nurses who would say, oh, the only reason I'm working here is because it looks good on my resume, because no one else wants to work here, so then I have good experience. And as we have this stage, then we see this pivotal study come out with continuous emotional support during labor in a US hospital. And as you can see with some of the highlighted areas, they use doulas, and they also have a control group where it's just a female observer who is just taking notes in the corner, not interacting with the patient at all. Now keep in mind, as I mentioned earlier, these are rooms where you have 12 women in beds giving birth to babies at the same time, or at least in labor, and no family members, no one there to support them. And so just even having an observer improves their obstetrical outcomes, but having a doula there, as you can see with some of the highlights, it significantly reduced the rates of cesarean sections and the use of drugs and forceps. And so this study, it's really, these men, they went on to found Doulas of North America, which is now called Dona International. And it is an organization which certifies and regulates in some ways doulas as a profession. And soon after, in around 1993, these same people, and by the way, these are all the founders, so Annie Kennedy, John Kennel, Marshall Klaus, Phyllis Klaus, and Penny Simkin. And all of these people founded DONA, and they were able to get the word doula added into most major dictionaries by 1993. And so here you see really there's this big recognizing of doulas as a legitimate, not just option for public hospitals as a solution, but also as a career. So before we saw, doulas is now just a term to describe a behavior that's existed. Then we see as it gets proved in a study that it does have significant positive impacts on obstetrical results, that this can be a solution for hospitals, especially public ones, where they don't really have a lot of resources and their patients really need some sort of help or intervention to improve their outcomes. And because of that, they were able to found this organization and really make it so that there are doulas in all sorts of realms. There's even death doulas now that can help you through all sorts of different life results, moving, etc. And so that was essentially the sum of my project. And for my future research, I'd be interested in looking at doulas in the 21st century, as well as using Charles Rosenberg's framing disease to look at other professions and how they've been framed after getting a name. And then here are my references. And thank you.